Hello and welcome everyone. I'm Dr. Sachin Kotastane from Lotus Medics. Are you finding it difficult to get pregnant? Are you having irregular periods? Are you finding that you've gained weight and are finding it difficult to shake it off? Well, you might have PCOS or Polycystic Ovarian Syndrome. What is Polycystic Ovarian Syndrome? Let me split the term. Poly is multiple, cystic is small little cyst. Ovarian obviously pertains to the ovary, and a syndrome is a constellation of different symptoms and conditions that come together. So it's not just having multiple cysts on your ovaries, but this is associated with multiple constellation of different things related to the hormones and to the abnormality in the hormonal function. So essentially, polycystic ovarian syndrome is a constellation of symptoms which include anovulation, or the inability for the ovary to release an egg, hyperandrogenism, which is excess testosterone or androgen levels in the body, coupled with hyperinsulinemia or resistance to the hormone insulin, which basically metabolizes sugar. Now let's see what happens in a normal ovulation cycle. In a normal ovulation cycle, there's a harmonious rise and fall of the hormones in the middle and the end of the cycle. The rise of the hormones in the middle of the cycle causes release of a dominant follicle or an egg from the ovary. And at the end of the cycle, if a pregnancy has not resulted, then the hormone levels fall, resulting in menstruation. In polycystic ovarian syndrome or PCOS, rather than have one dominant follicle, there are several follicles in the mid stages of development. These form cysts or fluid-filled structures in the ovary, causing the ovaries to become bulky and polycystic on ultrasound. In the absence of the harmonious rise and fall of the hormones, women often have irregular and delayed periods, and often these periods are heavy. Due to raised androgen levels, women may also have excess facial or bodily hair and acne. Due to insulin resistance, there may be weight gain, and this is difficult to shake off. There are three criteria for PCOS diagnosis: clinical, which is based on your symptoms; ultrasound, which looks at the polycystic features of ovaries on ultrasound; and biochemical, which is the hormonal blood test which your doctor may organize. According to the Rome 2 or the Rotterdam criteria, satisfaction of 2 out of the 3 criteria meets the diagnosis of PCOS. So what do I do if I have PCOS? Well, that depends on which stage of your life you are in. In the pre-pregnancy or the adolescent stage, the main issue is irregularity of periods. And this treatment usually involves regulation of period and treatment of any bothersome symptoms like excess hair or acne. This is usually done by combination of a hormonal medication like the combined oral contraceptive pill, and there are specific oral contraceptive pills which are tailored for polycystic ovarian syndrome, which can also reduce the androgen level in your body. Your doctor may also commence you on a medication to reduce insulin resistance like metformin, which can also improve your weight loss. The second scenario is if you're trying to get pregnant. Now, while it's true that polycystic ovarian syndrome can cause difficulty in getting pregnant, it's also equally possible that women may be able to get pregnant in spite of having PCOS without any intervention in certain cases. However, in spite of several attempts and after a long period of time, if you're still finding it difficult to get pregnant, please contact your doctor and they can refer you to a gynecologist to get further investigations. And the treatment can potentially be in the form of stimulating your ovaries to produce eggs, called ovulation induction. Let's discuss about certain long-term implications of polycystic ovarian syndrome. PCOS management needs to continue for life, as this condition has long-term implications. Women with polycystic ovarian syndrome have a high risk of developing gestational diabetes or diabetes in pregnancy, and so need to undergo investigations like glucose tolerance test early in pregnancy to be able to screen for this condition. Women with PCOS also have a long-term risk of developing conditions like type 2 diabetes or metabolic syndromes like hypertension or high cholesterol later in life. It is very important for them to be screened regularly for these conditions. Women with PCOS are also at a higher risk of having gynecological cancers like ovarian and endometrial cancers. This is owing to the very large levels or very high levels of hormones like estrogen and androgen. And so it is really important for them to be screened, especially if the bleeding continues to be abnormal or heavy, or if they have other symptoms of pelvic pain. Please continue to seek advice from your GP and your gynecologist for the long-term management of PCOS. For more information on this condition, please see the leaflet on PCOS and the information video on our Lotus Medics website. I hope this information has been helpful. Thank you. This is Dr. Sachin Korostani signing off for today. I hope you've enjoyed our video. If you have any questions or concerns or anything that you would like any consultation on, please do not hesitate to contact us on 1-300-356-887 or email us at admin@lotusmedics.com.au. Thank you.